Coming to the stage, you guys, is a man who actually gave me my first job in Hollywood. All right? And as you know, I've been working in Hollywood for 63 years. He's the television producer of the hit show Pacific Blue and American Soul. He is my good friend. Start clapping right now. You're going to recognize the last name. I said start clapping right. Doc, get your little table together, Doc. Give it up, please, for Mr. Tony Cornelius. Best dressed person here also.
Thank you, brother.
Oh, come on, sure.
You know, it's funny, Chris has always been the man with all the jokes. And as he said, he made an inside joke that you guys probably didn't hear. He said, you may recognize the last name, not the first name. So, you know, when he says Don, everybody knows who Don Cornelius is, but they don't know who Tony Cornelius is. But that's okay, Chris. That's okay. I know how you do me. Anyway, listen, I'm privileged to be here, and I was invited by a very nice young man by the name of Wayne Lindsay, who's going to be performing tonight. And I just think this is a wonderful opportunity for us, people of color, to meet and talk about health. And I'm actually excited to be here. So I would like to read a paragraph that was written by someone, and I really think the paragraph is written really well. So the intern that wrote this, I want to congratulate them on this paragraph. This is fantastic. So let me start by saying, African Americans are one of the racial groups least likely to be protected against shingles. And health professionals are often not properly trained to detect shingles on darker skin tones. We're looking forward to hearing about the things you need to know to keep yourself and your loved ones safe from shingles. Please join me in welcoming best-selling author and physician, Dr. Sheri Prentiss.
Guys, thank you for sticking around. This is like the hardest time to present anything, and I keep feeling like I'm bumping up something against my mic, but it's actually the mic. So good. Y'all want to find out something about shingles? I'm assuming that you stayed around because you feel that it is important to you and you want to learn a little bit something about it. So I and my dear friend Leslie up here, we're going to just have a little casual conversation about shingles. And we want to make sure that we cover a couple of things. We're going to go, what is shingles? What are the symptoms? Why you even need to know about it? What are some complications? What can you do about it? And where can you go to find out some more information? But we want to do it in a casual, laid-back atmosphere because this has been a long day. We've learned so much, but we're not done yet. So, now, what is shingles, girl?
Girl, you asking me?
Well, maybe.
Let me tell you something.
Tell me, girl.
First of all, if I have seen one commercial, is my
You want this one?
Hello, hello. Can you hear me now? I'm sure you can. So one thing I can tell you is I have seen not one, not two, and I'm sure many of you have seen it here. So many commercials, it's all over the television. You see it in CVS, you see it everywhere, the shingles commercials. And everybody's talking about it. And one of the things that I'm curious about, and I'm sure many others are, is why is all the attention right now on shingles? It hadn't been for so long, it's been out there forever, but the attention has been heightened, and especially in our community. So what is shingles, and why is it getting so much attention right this minute?
Fantastic question. Let me ask, by show of hands, how many of you in this room have had chicken pox before? Okay. How many of you in this room is 50 years old or over? Okay, and if you're not 50 and older, how many of you are living with someone who is 50 years of age and older? Okay, so all the right people are in the room. Here's the thing about shingles. Shingles is a painful, blistering rash that usually will appear in like a single stripe on either the right or the left side of the body or face. And it can appear in an area that is what we call innervated by a nerve. So it follows a nerve path. And this stripe, like I stated, can appear on the left or right side of the body or face. Blistering rash, painful rash. And it can appear either on your torso, on your arm, your thigh, your face. Imagine having it around your eyes or around your ears. Because it can also appear in any of those areas. And the reason why I asked if any of you had had chicken pox before is because shingles is actually caused by the same virus that causes chicken pox. And that's called varicella zoster virus. Exact same virus that causes chicken pox. So it's important, let me repeat, a painful, here's the word, don't just listen to the word rash. I want you to listen to these first two words. Painful, blistering rash that can appear as a stripe on the right or the left side of the body or the face, along the nerve path. It can be on the torso, an arm, a thigh, around the eye, or around the ear.
So, you know, knowing that you had chicken pox, most of us when we were very, very young, why does it take so long to develop if it is going to develop?
That is a very good question. Here's why. Because the varicella zoster virus, after it has caused chicken pox, can lie dormant in the body. It lies dormant in what we call the nerve ganglia. Don't worry about it. It just lies dormant in the body. And it can remain dormant for years. And you don't know nothing about it or not even thinking about it, but it's there. And the reason why it's so important for us to talk about it is because a lot of people did not understand the mechanism of action. They didn't realize that this is caused by something that is already in my body. Already in my body. You may be out there thinking, well, I didn't have chicken pox. My sister did, my brother did, my cousin did. Matter of fact, I don't even remember anybody in my family ever having chicken pox. So I'm clean. I don't have to worry about it, right, Doc? Wrong. Because whether you remember having chicken pox or not, y'all want to know what's really important and why we're talking about it now, why it's so crucial now, is because 99% of the people living right here in the US, if you are 50 years of age or older, you already have this virus lying dormant in your bodies.
Wow.
99% of us.
Well, I believe that. I actually have a personal story. I have an aunt that just turned 100 and she has shingles.
Wait a minute. First of all, let's give God the glory. You said she turned what? 100. And she had to deal with shingles.
Just recently, yes.
Can you imagine celebrating being alive for a century and then having to deal with a painful, blistering rash? Now, that ain't a birthday gift that I would want.
No.
No.
But she's on the other side now. So.
On the other side.
Yeah.
So when you think about 99% of us 50 years of age or older already having this virus dormant in our bodies, I want you guys to do me a favor. I want you to look to your right, and if there's somebody sitting at your right, say, hey girl, hey. Okay, and then look to your left, and nobody's at your left because they've already left. Look across the table and go, hey boo, hey.
Yes.
Reason why I want you all to do that is because 1 in 3 people will develop shingles in their lifetime. So which one is it gonna be? Is it gonna be you or the hey girl, hey? That's why we need to talk about it. 1 in 3 people will get shingles in their lifetime. And then once you get it, once you have the blistering rash, if it would just go away, you know, if it was just a little nuisance that lasted for a couple hours and went away, probably wouldn't be so bad. But there are complications of this disease.
And what are those?
The most significant one is a condition we call post-herpetic neuralgia. Honey, it's a long tongue. Post-herpetic, I heard somebody go, what?
Right.
Post-herpetic neuralgia. And really what it is, it happens in about 1 out of 10 individuals that get shingles. Imagine this pain, I mean this deep pain, this pain that will last in the area of the healed rash. So now the rash is gone, right? You've lived through the rash. So now you have the rash is gone, but in an area where the rash used to be, I'm still having this pain. Now keep in mind now, when you had shingles, your pain is either going to be 1 of 3 types. It's either going to feel like a burning sensation, it may feel like electric shocks, or it may feel like a stabbing pain. So imagine you got these painful blisters, and imagine something stabbing, or electric shocks, or just burning pain. You finally get over it, the rash is healed. But man, now I seem to have this pain that lasts for months or years in the same area of where that rash has healed up. So the rash is healed, but you're left with this pain.
Wow.
Or you could be left with scarring from the rash. You could be left with partial weakness or paralysis in the area that was impacted by that nerve. So if it happened on the arm, or if it happened on your thigh, that particular area could experience weakness or paralysis. So again, you dealing with the rash, you dealing with the other symptoms that could come along with the rash. You could have been going through headache, fever, stomach pains. Now this blistering rash, the rash is finally healed up. Okay, I'm getting ready to move on. And now you're left with months or years worth of this post-herpetic neuralgia, of this pain where that rash has now healed up.
That is awful. But how many people generally, what's the percentage of the population that suffer with the major complications out of people that actually get shingles?
That one that can last for months or for years, that pain, 1 out of 10.
That is 1 out of 10.
1 out of 10.
All
1 out of 10.
those,
So that's
wow.
significant.
That is
especially
very
when you're thinking
significant.
about 1
Yes.
out of 3 of us, 50 years of age or over, can get shingles in our lifetime, right? And then 1 out of 10 of us is going to be left with this pain that we have to live with for years in the area where the rash has healed up. Awful. Absolutely awful. But that's why events like this is so important, because we need to have the correct information.
Yes.
We need to stop thinking
Definitely.
that, oh, if I didn't have chicken pox, that I'm not at risk. Or, oh, yeah, I've had shingles. I've had chicken pox, but no, once I got over chicken pox, I'm done. I don't have to worry about, quote unquote, getting it again. Well, you're not getting chicken pox again. What you're getting is a new disease process called shingles, caused by the same virus, but your symptoms and what you're going to be left with after the fact, very different.
And it's unknown, so you don't know who's going to be. You could get shingles and you don't know how severe it'll be. It's all unknown. Is there anything that predicts whether you'll have it more extreme than others?
There's not something that predicts whether or not it'll be more extreme, but there is something that predicts and goes along with our increased risk. Here's the deal. As we age, our immune system begins to weaken. So our immune system's ability to fight off this reactivated virus is weak. So it can't prevent as well as it could and did when we were younger. It doesn't have the strength to prevent the reactivation of this varicella zoster virus that's been lying dormant in our bodies. So as we age and our immune system weakens, it increases our risk for developing shingles in the first place. And that's why it's so important for those of us that are 50 years of age or older to know what shingles is, to understand its symptomatology, to understand what the implications are, and to understand what causes it. Not just for ourselves, but I don't know about you, but I got brothers and sisters that need to understand. My blood brothers and sisters, my cousins, my neighbors, the people that I work with, because trust you me, I don't want to be around anybody with shingles.
So,
Just like you don't want to be around anybody with chicken pox.
yeah, so is it contagious?
You ask a good question. Yes, when that rash erupts and you got this blistering, when I say blistering, y'all, I mean like these things ooze. They ooze. It's not comfortable at all. So now when you have this rash, yes, if you are exposed to young children, they have not received their chicken pox vaccine, and you're around older individuals who may have other things that are weakening their immune system. They're immunocompromised because they have other chronic disease processes in their bodies, right? Maybe hypertension, diabetes, lupus, whatever. A number of things that decrease your immune response. Now you are at an increased risk of developing it. And if my immune system is already compromised, I get around somebody who has this rash, and now I get exposed in either touching or not being careful. Now I've placed myself at an increased risk of me getting shingles on top of the other medical diagnoses that I'm already dealing with.
Right.
Yes. So it's not just about you. It's about you, your loved ones, everyone you come in contact with, and like I stated, even your coworkers. The reason why you need to understand disease processes, because you may do right by you, but you may be working with somebody that they don't know. They don't even know what they have. And so if you educate yourself on the process, then when you see it, you can now point it out to them. Exactly.
It's like the caregiving situation.
Correct. Correct.
You know that. Now, in terms of one of the questions that we had earlier was that if people are already vaccinated, you mentioned that if they had a baby's been vaccinated or someone else has been vaccinated, will they have a chance of getting shingles again?
Well, here's the thing. When I was a kid, I received the varicella zoster vaccine. I still end up getting chickenpox. I don't recall when the time period was, but I ended up with chickenpox, right? So even if you're living in a home with a small child who has been vaccinated against chickenpox, right? And or you're living in a home with grandma who has had all types of treatment for various viruses, including covering herself from shingles. You still don't want to place yourself in a position where you are potentially infectious to someone else. Just like we're all boosted up for COVID, I still, when I get on a plane, I'm sorry, I'm putting on my mask.
Right.
Not just for me, but out of consideration coming here. I could have ridden on the plane without a mask, but then now I'm suscepting each and every one of you to potentially to my exposure. So you just need to be very, very careful because you don't understand and may not necessarily know everyone's medical condition at the time of the eruption. So you want to make sure that you keep yourself at a distance. And man, I don't know about you guys, but my oldest daughter just got married this past weekend. And although I told my two daughters, I said, I would never tell you when you gonna have me some grandbabies, because I didn't want to put that pressure on them, because once you have them, they here, child, and you carry them with you always. But now that she's gotten married and they want to have kids on their own, the last thing I want to do is to not be able to hold my baby
Of course,
my
right.
baby, they call me Gigi because I got shingles, because I got a rash that's erupted, or because I'm going through so much pain I can't even have somebody touch this area of my arm because of that complication of that
Right.
post-herpetic neuralgia, or being in a position where I can't even hold her because I've experienced weakness in this arm because this is where the rash was, and I'm left with partial weakness of my arm and I can't hold her the way I want to. No, we got to think past just the time period of the condition itself, and think about how having shingles will impact your entire life, from work to home to play to intimacy to all of that. Because I promise you, as a physician and a patient, it will all be impacted.
Yeah, and you know what? You're so right about this. We really need to have more conversations in our community about shingles, and also things that we can do in terms of protecting ourselves. When you're thinking about the 50 and older group, how are you able to, do you go into senior homes, or how do we get them engaged to think about it? Because most people, it's still very difficult, even with the commercials and everything that's out there, for people to really, and you're so engaging in terms of how you tell the story, but for them to really actualize it for themselves. It's almost like you don't really see it until you know somebody that's been through it.
Correct.
How do we get that conversation started in our community beyond Black Health Matters, and also what else can we do?
Well, you know what? One of the first things you can do is just within your own circle, whether it's family, work. I'm part of a support group at church. I'm part of the Women's Day at church. I'm part of the YMCA and doing whatever. Just even asking the question, girl, this past weekend, I was at this summit and they was talking about shingles. I hadn't even thought about it that way. Girl, what do you know about shingles? Just asking the question to people that you're not only comfortable with, but within the circles within which you run. I just recently placed my dad into assisted living. Once I got him settled, I immediately offered up my services. Hey guys, I'm a physician, and there are certain conditions that I know that we need to be more cognizant of, and as we age, there are certain things we need to take care of. I'm more than happy to come in, have some frank conversations that will open up the door so that they can be well informed. I'm just giving them information. I also have my master's in public health, so I'm coming from a public health expert position as well. And then now just having those conversations, eyes just begin to open that people thought the word shingles had to do with the stuff that was on their roof of their house. They didn't know that it was an actual condition because somebody told them, oh, they just got chicken pox when they were 54, or when she was sick. Girl, she got chicken pox late in life. Then when you ask the questions, well, where was the rash? Was it all over? No, she just ended up having it. It was like right around her chest, like right here. And that's not chicken pox. That was shingles. So when you know better, hopefully, prayerfully, we do better.
And we also need to talk to our PCP, our primary care physicians, about this. It doesn't always come up in conversation. It's something that we have to bring forth, just like we do with so many other areas of health.
Exactly. Just like what I think just about every person that stood up on this stage has said, you have to talk to your physicians. And I will tell you this, and I love the pharmacists that have just poured out, because those are the two people you really need to be asking the question. Talk to your doctor and your pharmacist about shingles. You have to know, because what I'm giving you is the general knowledge.
Right.
But you can get more specific knowledge and know what's best for you, when you need to do what, where you need to go, when you talk to your doctor and your pharmacist. There may be some information that I left out, so I'm going to say this before I forget. If you want to know more information, you weren't able to take down all of the notes, go to whatishingles.com. Simple as that.
Excellent.
Whatishingles.com. Spread that to your friends, that if they want to know more and you say, well, I don't remember the statistics and I don't remember the name of that complication, just tell them to go out to whatishingles.com for more information. But to sum it up, Shingles is caused by the same virus that causes chickenpox virus. That is the varicella zoster virus. It appears and shows up as a painful, blistering rash that can appear as a stripe on either the right or the left side of the body or face along the nerve path. It can appear on your torso, on your arm, your thigh, around your eye, around your ears. The most significant complication, the most pressing one, is post-herpetic neuralgia. It affects 1 out of 10 people. It is pain that lasts for months or years in the area of the healed rash. And remember, you can also experience partial weakness or paralysis in the area that was affected by the nerve if shingles becomes reactivated. And 99% of us here in the US, 50 years of age or older, already have the varicella zoster virus that is lying dormant in our bodies. And so 1 in 3 will develop shingles in their lifetime. Don't let it be you. Go to whatishingles.com.
Well, thank you so much, Dr. Sheri. You're so fabulous as always, and very, your description of everything was so entertaining, engaging for the audience. I also want to let everyone know that the Shingles booth is still open. If you have questions that you'd like to ask, or if you'd like some literature, please visit the Shingles booth here or GSK. Thank you so much.